Let's invite the next person, and one of the most prominent person in our country. World across the world, he is known, and person who eats only chilies every day. So he so he can take us through the various diabetic retinopathy programs, and Dr. Natarajan, you all know, is a wonderful clinician, and actually he is a researcher, and worldwide he's philanthropic. Dr. Natarajan, please.
Thank you, Dr. Thank you, TTL, and thanks to Arun for inviting me. My good friend Jerry is here, whom I first saw as a resident in '83 in the Bombay conference, where I met Fidrao and many others. I thought I'll do IOL that time. I never knew I'll go into retina the next year. So the topic I took is taking eye care to doorstep of Mumbai slums. I decided, seeing the busy Mumbai, we had a clinic next to the Fan railway station, and then I used to see that the people keep running between the station and their home, and nobody wanted to come to the clinic. The reason was they're all working for their bread, butter, and that's why they run. They don't care about their health. So I decided we have to visit every house, and so Mumbai slum face significant healthcare challenges, including access to eye care. We have the Sion Medical College, the Lokman Tilak Medical College, which is in the heart of the slums of Dharavi, and where the slumdog millionaire was taken. And now I am an emeritus professor of ophthalmology there only to serve. And I think the reason is the patients don't have time to walk in. It's just 500 meters. Another 5 meters other side we have a vision clinic in the slum for the last 25 years. Because my father said, he was an ophthalmologist, he said, you are a busy practitioner, you have to do something for the poor people. What are you going to do? So I started doing charity from '88, but 2005 we made this foundation, and I decided to do free eye care. Large portions of population live in overcrowded areas with limited healthcare resources. Eye-related issues like cataracts, refractive errors, and infection are common but often untreated. So the geographical barriers, slums are often located in areas with limited access to healthcare. Actually, there are municipal clinics where inside the slums, but people don't go, and that's the problem, because they're all running around to make money, and they have a lot of money, but they lose their health. And I think, according to me, they just die without. But they're all from all over India, and they come to Mumbai hoping for a big breakthrough, but unfortunately the area is so small. It's 7 islands merged into a peninsula, and people, the rate of land is very high. And high cost of treatment and surgeries make access difficult for low-income residents. And lack of awareness, and that's the biggest problem, I think, all the rural and slums. Many people in slums are unaware of the importance of eye health or available treatment. And healthcare services in Mumbai are often overwhelmed, especially in the slum areas. So the problem faced in our health system, sometimes the unreliable internet coverage, which is not true for Mumbai, but it's for the villages nearby, deficit in supply of electricity in many areas, shortage of trained medical staff for operating conventional fundus camera, and portability of conventional fundus camera. So we have done this. We have social workers. Earlier, before COVID, we had 30. Now I am again building up. So we go door to door, and I think we have a better statistics than the Mumbai Municipal Corporation. And I work with them. We have an MOU, but still, we unfortunately are using the books and papers to write their data. I think the social workers have the data of their family, their income, their what they need, not only eye care, they also talk to them for their gynecology or urology, whatever they want, even though the hospital is nearby, but they guide, and they have access to every house in slum. And when I go with them, many times they are lost because it's like a maze, you can't come out on your own. And we also there are a lot of schools within the slums, and we do school screening camp. And my father insisted that I should go and give talk on how to take care of diabetes and diabetic retinopathy. I used to tell them, what do I do with the school children? He says, no, they have grandparents, and if you impress them, they may go and with love tell the grandparent, come for the eye checkup, or they may bring. So this is what we do every day. I keep telling my residents and the doctors who work with me that we should conduct, apart from the screening, we also teach them the parts of the eye and also how to take care of the eyes. So this is a general eye screening camp, and wherever we have space, sometimes in the small temples inside the slum and sometimes in the community hall, we keep doing. And we also use the low-cost screening devices at primary eye care centers. So we go in almost inside the slum everywhere and create this center. And this one on the top right is a Zeiss camera, thanks to the World Diabetic Federation, where they gave a foundation from Denmark. They gave us the grant in 2012 for 5 years. And then we had a van, we had Zeiss camera, it's still working, and we have Zeiss laser. And the idea was them to give the know-how and also do a capacity building. And these are some vision centers in various slums of, because we have 2 million people living in Dharavi, another 4.5 million people living in the whole Mumbai slums. It has I recently learned the entire Mumbai is made of 23 islands, which is up to Malad and Dahisar and other places. So we do all the slums. You can see sometimes we get a place under the tree, we do the screening, and we are not shy, and sometimes the smell is so bad. So I hope one day to teach them the Swachha Bharat, apart from eye screening, to teach them cleanliness and hygiene. I hope to do that. It's a tough thing. I mean, unfortunately, now the Adani has got into that Slum Rehabilitation Act. They are claiming they are going to make it like the BKC or the Dubai, the entire slum rehabilitation. I hope it will happen. But 1992, the former Prime Minister made the Slum Rehabilitation Act, and Slumdog Millionaire came. Several movies have come. Still, there are 25 tourist companies taking all the foreigners to see how these slums they are living, and sometimes they also have somebody lives there, because there many things like leather products may be made here in Dharavi and goes to Europe with a Gucci and other things, and nobody knows that. And thanks to my friend, late Dr. Abdul Kalam, every day, he always was my motivator, because he used to tell me, you are a big gun in retina, what are you going to do for glaucoma? And he was aware of so many things in ophthalmology, very impressive. And whenever I called him, he was a president, as a past president, and even before president he came, and this is one of the functions in 2010, he used to come and visit. The idea was to make him meet all the social workers and encourage them to work. And thanks to here, my late grandmother was inaugurating this motorbike, where thanks to Forest, Mr. K. Chandrasekhar is there, no financial interest. The fundus camera we carry in the motorbike and inside the slums. So it was old called Aditya Jyot Foundation for Twinkling Little Lives. Dr. Kalam gave me the name of this foundation because his friend was Dr. Reddy, who has the Little Heart Foundation, and he told me, why can't you do some twinkle in the eye? Dr. Natarajan used to tell. So we have this van, and if you take a regular fundus camera in a motorbike like this, the optics will go. So we have this boy who's a 9th standard pass. He carries the optics in the backpack, and then the hardware in the box, and then he can reassemble in a few minutes. And then this is what we do. We go to a community area, check their vision, and then in case with the dark room and the 4mm we can take photograph. We do that, and I think 45% we can do without dilatation, and 55% we use 1% tropicamide, which has been now used by the various studies in UK, and found the angle closure glaucoma is almost nil, even though we are aware of it. So we are aware that if there's a problem, they'll be referring. And you can see they can take beautiful pictures, and this can be connected to AI. And the other company which I work with is Remedio, again no financial interest. The computer is trained to accept retina pictures properly taken by the trained non-skilled worker and make him into a semi-skilled worker. That means give him one skill. I have spoken to the National Skill Development Corporation in Delhi to give them a 3 weeks training, we made a curriculum, but unfortunately after the COVID we could not follow up. Now again, I think I'll have great time to do that, so that we can give a certificate to the people who are not past 10th, because the skill development is given to a person after passing 10th or 12th grade. But we want to encourage people without any school dropouts to get this training. So we have 6,47,645 villages. Only our Prime Minister has access at one go every year to talk to the villages, village panchayat, which we don't have. But we can't do that screening, but I want to screen. I know it's a mega project. Maybe it cannot be done in my lifetime, but I think I want to initiate it. And so this is a picture which we can, the picture can notify the staff. That means he doesn't know to read English. So that's why instead of the Romeo police in UP, I want to tell the UP Chief Minister, we can train them to do the retina photograph, and then that AI will tell this patient needs to be referred to the diabetic retinopathy, and this need not be. So this is the one which can be more. I can take a minute, Dr. Chetia? Okay. So can be mounted on a suitable bike, you can transport, can be mounted on any table, and both the mobile phone, it's an iPhone 5, 6, 7, 8. Again, I don't have any. I tried contacting the iPhone, that Tim Cook, I tried meeting him and to ask him to support where all the villages, and the other one is Google, but anyway, Google has their own program. But I'm happy we are working with this program from 2017, and it's chargeable. You can see.
In order to acquire an image, please ensure infrared view of the
So actually you can see that anybody can be trained.
you are able to touch the screen to autofocus. You are now ready to take a shot.
So you can see they can take a good photograph, and then now the Remedios come out with the 3 software for ARMD, diabetic retinopathy and glaucoma, and we can capture the fundus curve like this. We have trained, and then we have several projects in the slums on called CREAM project for the children refractive error, and earlier we called it AJ drums, and we also had Dharavi war against diabetic retinopathy. But the whole idea is to reach all the 6.5 million living in Mumbai slums, and I want to take the eye care to them totally free. And fortunately, Mumbai people are very nice and kind, and they have given a lot of money. We have now recently got a 15 crore worth property for doing a charitable work, and another 3 foundations are giving me 5 crore. It's not enough. I have asked for more because we want to employ and pay the doctor well so that he can do well, and then he need not look for private practice and do surgery. And we can make India free of the burden of diabetic blindness, and teleophthalmology can show us, and eye care can reach every village via teleophthalmology and artificial intelligence. Thank you.
Thank you, Dr. Natarajan. I think, a wonderful initiation, a lot of good work, and best wishes for your cream and drums.
I hope all of you can come and have a look.
Sure,
one
sure.
day.
Yeah, let's have